Hi guys, today we're gonna talk about GERD. So GERD is gastroesophageal reflux disease. So in GERD, what happens is that the gastric juices in the stomach, for some reason, they regurgitate back to the esophagus, causing some irritation in the esophageal lining. So to explain this, I want to just briefly review our anatomy and physiology. So recall that, we eat, we put food in our mouth, it then goes down to the esophagus, and then once it hits the most distal portion of the esophagus, we have a sphincter there. It's called the lower esophageal sphincter, or the LES, L-E-S. And then after the lower esophageal sphincter, the food then goes to the stomach. And then the stomach again has another sphincter that opens up to the intestine. So here we have the pyloric sphincter. So again, we have the esophagus, and then we have the lower esophageal sphincter, and then we have the stomach, and then we have the pyloric sphincter, and then we have the intestine. Okay. Also to review, in our stomach we have gastric pits, and in these gastric pits we have different types of cells that release different enzymes and different proteins for digestion. So we have our chief cells, and the chief cells, what they do is they secrete pepsinogen, and pepsinogen gets converted to pepsin. And the function of pepsin, it's heavily involved in the digestion of proteins. We also have our parietal cells, and our parietal cells, what they do is they release hydrochloric acid. We also have G cells, and these G cells, they release gastrin, and gastrin is responsible for stimulating the release of hydrochloric acid from our parietal cells and for the stimulation of gastric motility. The stomach also has a very special mucosal layer. So it has this lining that protects it from corrosive agents. So like hydrochloric acid and other enzymes involved in digestion. And when there's reflux, so when there's regurgitation of these corrosive agents into the esophagus, because the esophagus doesn't have this special lining that can protect it from such compounds, unlike the stomach, what happens is that these corrosive agents, they cause irritation and inflammation of the esophagus. And the esophageal lining, eventually, if this happens chronically, it can develop scarring, and it can lead to the stenosis, or the narrowing of our esophagus. So how exactly does this happen, and why does these corrosive agents regurgitate back to the esophagus? Well, there can be two potential scenarios. First of all, we can have a really full stomach. So if we've eaten so much in one sitting, our stomach gets really full. And when it gets really full, then the food doesn't have anywhere to go. So what can happen is it can push onto that lower esophageal sphincter. It may open, and then we may experience regurgitation of some of those food stuff and the corrosive agents produced in the stomach. The other scenario is if we have a lower esophageal sphincter that's not very well functioning. So if we have problems with the nerve innervation of the lower esophageal sphincter, or for some reason it just doesn't close properly, then it means that even if we don't eat so much, it's very easy for that to just open again and let some of that corrosive agents out from the stomach into our esophageal lining, into our esophagus. So what are some of the risk factors then for developing GERD? So firstly, we have obesity as a risk factor. The second one is old age, because as we get older, the tone, we get a decreased tone of our lower esophageal sphincter. Smoking can be one, and potentially even having a hiatus hernia or hiatal hernia. Some of the potential triggers or contributing factors to GERD may include different types of food, like spicy foods, fatty foods, chocolate, caffeine, very guilty of this, alcohol, and even carbonated drinks. Another potential trigger is overeating. Obviously, if we eat too much, the stomach gets really full. It pushes onto that lower esophageal sphincter. Another potential trigger is like eating and then after that lying down after eating. Again, this is bad because, you know, when you lie flat, then you tend to relax the lower esophageal sphincter, may open, and we may regurgitate what we've just eaten and some of the corrosive agents in our stomach. The last potential trigger, or something that can make this worse, would be medication. So for instance, like NSAIDs, especially like ibuprofen and even aspirin, and even some antibiotics like tetracycline and doxycycline. Some of the signs and symptoms include like dyspepsia. So this is that uncomfortable feeling you get in like your upper abdomen after eating or drinking. It's like that indigestion feeling. So that's dyspepsia. You can also get pain, and GERD is actually very it presents like, sometimes it can present in the chest, so we need to be able to distinguish GERD from an actual cardiovascular event like an MI or something, like, you know, something of a cardiac origin, because it can present like in this region as well, can present with chest pain. Another thing is that they may have chronic cough or like inflammation of their vocal cords called laryngitis. They may have difficulty swallowing. This is called dysphagia. What else? So they may also, obviously they may get pain after eating, and this pain may be worse when they lie flat. In terms of diagnosis, we can do an ECG, and this is simply to rule out any cardiac problems, because I said like it presents like in the same place where a pain from an MI may present, like central chest pain. So we need to exclude any potential cardiac abnormalities here. So we can do an ECG just to rule out any cardiac abnormalities or problems there. And then the gold standard for GERD is called the esophageal pH monitoring. So this test involves like threading a like a thin tube into the patient's nose or mouth, and then it goes all the way down to the esophagus. And it measures the pH of the esophagus. And the person has to wear this for 24 hours at least. And at the same time, so this probe, this monitor thing, it collects pH readings of the esophagus. And at the same time, the patient is told to keep a diary of what they've eaten and things like that. And then the pH readings in their diary is reviewed by their doctor after this 24-hour period, just to collect information and to see if acid is regurgitating to the esophagus, how much of it is going to the esophagus, and how well the acid is being cleared back into the stomach, and how fast that process happens. So it gives us all of these kind of information. Another test you can do is called a barium swallow. So barium swallow is basically, it involves asking the patient to swallow like a solution of barium. And the doctors would then take like x-ray of the esophagus. And what this will show is any like changes in the lining of the esophagus, any like esophageal changes, any issues with the mucosa of the esophagus, like for instance any ulcers. In terms of treatment, so we can give them PPI, proton pump inhibitors, and these decrease, you know, the secretion of those gastric juices. We can give them, so an example of this, by the way, is like omeprazole. We can also give them like something that works similarly, so like a histamine 2 receptor antagonist, again, that decreases the secretion of like gastric juices from these cells in the lining of the stomach. Another one that they can take is antacids. So these like medications, what they do is they neutralize the acid in the stomach. On top of like the medical therapy, we also recommend them to do some like lifestyle modifications. So we ask them if they're obese to try to lose some weight, improve their dietary habits. So, you know, avoid those foods that may trigger GERD, like what we said in the beginning. So caffeine, carbonated drinks, alcohol, fatty foods, spicy foods, chocolate, peppermint. So these are some potential triggers, and we tell them to not eat very, very large meals, not eat so close to bedtime, and you know, if they have to lie down after eating, maybe to prop themselves up so they're not completely lying flat, just to prevent that regurgitation of acid and food stuff up to their esophagus after eating.